right-hand corner, wherever you should see. So there we are. We are live. Hello, everyone. Let's see. And right now, it is you and I. No, we have people coming in. Excellent. So good to see everyone. While we're getting set up here, I would like you to go ahead and introduce yourself. You'll see a chat box. And if you can tell us where you're coming in from, that would be great. I have a very personal reason for asking you that as well, because I'm looking for good weather somewhere near Jeff City so I can see the eclipse. So that'll be great. And we're going to get started here in a moment. Where's my other page? There we are. Okay, so again, I'm going to say welcome everyone, and if you'll just type in to the chat box that you'll see on your right-hand screen, you'll see a little box down at the bottom, and just introduce yourselves and tell us where you're from. That'll be great. I want to wait just a few more minutes before we get started. And if you are here for the Missouri Nurse Practitioners, you are definitely in the right place. Good morning or good evening, William, Dave. Hi, Dave. I haven't met you yet, but I've heard a lot about you, so I'm looking forward to meeting you. Anise, Quentin. Hi, Quentin. I know you. It's nice that I know some folks here. And someone from St. Louis, Susie. Jill from Eldon. I've seen Eldon on the map. Karen from Carl Junction, outside of Joplin. Okay. Lone Jack. Oh, I don't think I know that place. All right, excellent. So it is already 5:02, so let's go ahead and get started. First of all, I'd like to welcome everybody. I'm Barbara Phillips, and I am a transplant to Missouri from Washington State. I've now been here just about 3 months and still learning my way around. And I'll tell you a little bit how this came about in a moment, but just in case, I want to let you know a few things. First of all, there is a delay. So when Shanna and I are talking, you will hear us about 30 to 45 seconds later, and that's just a function of the Google Hangout technology. Secondly, if you get disconnected for any reason at all, please just refresh your browser and you should be able to pop right back in. At the bottom of your chat, or where you are typing in for your chat, you'll see that there's a little bubble there. If you will go ahead and click the arrow that goes down, you will see that you can have a Q&A or a chat. And if you will, when you have a question, and this is completely interactive, if you have a question, if you hit that Q&A, I can see it easier to let Shanna know that they're there. Because Shanna, I don't know that you can see those.
I cannot. You are correct.
All right, great. And I just want to let everybody know this is being recorded, and there will be a replay available, and it will also be on YouTube unless we decide that it's not going to be there. And you can actually ask to come in and talk, but I'm going to let Shanna do her thing first, and then we'll bring in all the Q&A or if somebody wants to jump into the room and actually talk with us and be on camera, that'd be great. So let me tell you how this all came about. I told you I'm new here in the state of Missouri. I came from Washington State, where we have full practice authority. And for all but 1 year of my longish career, I have practiced under full practice authority. And I was looking to get involved with the different organizations, well, with Mona, because that was all that I could find. And I was having a hard time getting some information about it. And I'm not even sure how I stumbled upon the Association of Missouri Nurse Practitioners. But then I got into a conversation with Russell and then with Shanna, and I said, well, how about if we do something like this? Because I tend to do a lot of webinars. So that's how all of this came about. And I have been learning a tremendous amount of the uniqueness for Missouri. So anyway, who we have here with us tonight is Shanna Chapman, and she is the president of the Association of Missouri Nurse Practitioners. Currently, she is the president-elect of the Advanced Practice Nurses of the Ozarks, the vice chair of the Missouri Council of Advanced Practice Nurses for MONA, and she sits on the advisory council for the Missouri Centers of Nursing and the Missouri Action Coalition. And I can go on, but I think I'll stop there because this is one busy woman, and I would love to just, Shanna, take it away.
Well, thank you so much, Barbara, for inviting us to do this. This has been wonderful, and it's great to reach out to everyone and to have something that's interactive like this. We basically just recently formed the Association for Missouri Nurse Practitioners. We actually signed our paperwork with the Secretary of State on June 30th with nothing more than just a dream and high goals. And it's amazing when something is supposed to happen and you've got two hard-working people behind it, how it just does. And since June 30th, it's just been amazing how quick everything has went, how nicely everything has fit into place. And it's just one of those things that are supposed to happen for a reason. We had decided when looking at the state of Missouri, we are the single worst state in the nation for Missouri APRN practices. Florida used to be worse than us, and they passed legislation in the last season where Florida actually is better than we are now. So now we're considered the #1 worst, although I'm not sure that's a title that we like. When you look at health outcomes for the state of Missouri, we are 49th worst in the nation for providing immunizations for our kids. We are 42nd worst in the nation for preventable cardiovascular deaths. We are 40th in the nation worst in hypertension. We are terrible for access to care. We've only got 6 counties that are not considered healthcare provider shortage areas. And it was really time that we needed to get an organization dedicated to APRN practices, and so that we could hopefully work together with MONA and have more support in the state of Missouri, making coalitions so that we could advance our practices. Our other big goal of the AMNP is we want to serve for a resource. And when I say serve for a resource, that can mean a lot of different things. We have nurse practitioners and CNSs contacting us with problems with their collaborative practice agreements, or problems with their collaborating physician are telling them they're supposed to do things that they're not, or maybe that they can that they're not. We've had problems with hospital systems telling APRNs different things. And so we want to be that resource. We want to serve all of the APRNs in the state of Missouri, so that if you're having a problem or a question, regardless if you are a member or not, that you can call and we can help you. We also want to serve that need for continuing education. We all need those continuing education models. So we're in the process of setting up around the state different continuing education, such as suturing classes, joint injections, EKG interpretation, derm biopsy classes, and then we also plan to have a conference once a year. So we really are trying to just be a good overall resource. Some of the things that we have gotten to be able to do over the last 2 months, and like I said, it's just went crazy. We've been able to be involved with the State Board of Nursing, with the Rural Health Summit, with the Missouri Primary Care Association, invited me to speak at their conference. We've got to go to Columbia and be part of the Nursing and Policy Roundtable. There's a coalition out of Columbia that we've gotten to be part of, and it's just amazing at the amount of people and the amount of stakeholders in Missouri that really want to see the barriers reduced for nurse practitioners so that we can improve the access for Missouri patients and improve health outcomes.
You know, there are so many questions that I have as somebody who is new to this state. And just based on questions that I get from nurse practitioners around the country, one of the things that I often hear is that people don't really understand their Practice Act as well as we all should understand them. Because I do get questions a lot of the time. Can I do this in my state? Can I do that in my state? So I guess for me as a newbie to Missouri, and I don't know if other people have those questions, but could you address maybe some of the more common things that you had mentioned that people are not really clear about what they should be doing or not doing?
That's a very good question, and it's kind of a unique answer. If you look at the statute, our practices are primarily set up in statute. Our statute is very broad. In fact, when I did my doctorate project at University of Iowa back in from 2010 to 2012, the law school at Iowa actually took a look and they couldn't believe how restricted our practice was, because by comparing the statute and looking at different states with full practice authority, our statute is actually more broad than their statutes. However, Missouri has a thing called the Joint Promulgation Committee. And when you look at the Joint Promulgation Committee, it is a committee consisted of the Board of Nursing, the Board of Healing Arts, and the Board of Pharmacy. And they are the ones that set up the rules and regulations from the statutes. In 1990, we actually were 24th overall in health outcomes, and we did not have the collaborative practice agreement or the barriers that we have today. Since that time, as we've put on more barriers to APRN practices, we've actually fallen about 75% to where we're now 42nd worst overall with outcomes. Mizzou recently did a study last year. It was published, and it's amazing because it's well known, and they got national publication from it, national attention, and they actually compared the states that had reduced barriers and looked at their health outcomes compared to the states with more restrictive outcomes. And of course, they did find all of the states that did not have the barriers that we do had significantly better outcomes.
You know, in addition to NP practice being so restricted here, the other thing that I found rather interesting, well, not interesting, I'm sorry, but I found it rather sad, is that Missouri is the only state that doesn't do prescription drug monitoring. And since my specialty practice had been pain management, that was something I was particularly interested in. And do you think that there's a correlation between the folks that are blocking NP practice and that are also blocking something that's such a no-brainer, such as prescription drug monitoring?
I don't think it's a direct correlation, and the reason I say that is Senator Sater sponsored that bill for 3 different years, and it has fallen. In the state of Missouri, one senator during session can actually do something called filibuster, and honestly, Senator Sater put everything he had behind this bill. Several different organizations testified last year, including MONA. Several of us went up and testified on behalf of that, but unfortunately, due to the language in the bill, it was passed down. I had personally talked to Senator Sater last week when I was at the Capitol for the veto session, just to ask him if he was going to re-sponsor that this year, and he is undecided at this point, which is sad because we are the only state without it. And I personally think our patients need it for safety. We need it to prove that we are safe for our practices.
Right.
So
right.
I really hope that will come about this year.
Yeah, that was probably my favorite tool to use in doing pain management. It really helped my patients, and they also knew that we were keeping up with everything. So you mentioned that you were at this veto session, and I know for me, I didn't really understand about that and some of the other legislation that has recently taken place. So can you address some of those things? What's been going on that we should all be aware of?
Definitely. Well, this last legislative season, we had a House bill that discussed APRNs prescribing hydrocodone. Originally, hydrocodone was a class 3, and APRNs could, in the state of Missouri, prescribe a 5-day supply with no refills. When the DEA came in and reclassified it as a class 2, APRNs in Missouri could no longer prescribe that. So there was a bill that was brought up to specifically give us the power to write for only the hydrocodone for class 2, and it would be just like the other class 3s. It would be a 5-day supply with no refill. It did pass by a bipartisan vote through both House and Senate, but unfortunately, once it got, I'm going to back up here. I just got sidetracked. Unfortunately, that bill did not get passed. Then we had the second bill that went in for the death certificate legislation. That is the bill that got passed by the bipartisan vote all the way through the House and the Senate, and it got all the way to the governor's desk, and it got vetoed by the governor. So we later found out no one could understand exactly why he vetoed, but apparently there was some language on it that the Department of Health and Senior Services felt like that it was going to actually take longer to get death certificates signed. So one of our key players on our advocacy team was able to speak with the governor, was able to speak with his advisors, was able to speak with the Department of Health and Senior Services, and cleared up those inconsistencies. Even though once the governor vetoes it, it's out of the governor's hand, we still felt it was important to show the governor the correct information about this bill, but it had to go back and was given in the veto session, and it was presented, and it did pass by a high majority. So APRNs now can sign the death certificates.
Okay, so we can sign death certificates now, and then we can still then do a 5-day supply of hydrocodone. So those are the two big things that have gone through? Is that correct?
Those are the two big things that went through. On a national level, we got past the DME equipment, except for diabetic shoes. That was not written on there. I think it was faulty language. So AANP, who's American Association of Nurse Practitioners, is going to go back and try to fix that this next year. So we're really hoping that that goes through. But now APRNs are able to see their patients. They are able to do the face-to-face encounter, which includes the, for instance, if your patient needs a cane, a walker, whatever the need may be, except for the diabetic shoes.
I cannot believe how much trouble we have with diabetic shoes. I mean, It's a no-brainer, totally.
Some of the things that we're already going to be working on this next year is we have committed with the State Board of Nursing already that we are going to support the RN compact licensure. The State Board of Nursing actually wants to support the APRN compact licensure, but we do not feel with current administration that it would be successful this year, so they are going to hold out another year, but they are going to proceed with the RN compact licensure. Right now in the state of Missouri, when you get an RN compact licensure, you there's 25 other states that are in this compact. The last state that just joined was Montana. Well, when you look at that, you can legally practice in every state. Well, some of the other states had some very big misgivings or misconceptions, I should say, and one of the reasons they didn't want to join was they may not particularly agree with Missouri law. For instance, Missouri currently does not require continuing education for their RNs, or they, in Missouri, if you get a felony, the State Board of Nursing will look at each case by case, to determine if you can still work as a nurse. However, in other states, that's not necessarily the case. For instance, in Illinois, The Illinois, if you get a felony, regardless of what it is, you're no longer allowed to have a nursing license. So what the National State Boards of Nursing came up with was, if you meet the licensure requirement for the state of Missouri, but not for the national, then you can apply for a single state licensure, which means you would be licensed in Missouri, but nowhere else. However, if you met the licensure requirement for the compact licensure, then you would be licensed in all 25 states. And hopefully, but if this legislation passes, hopefully that will open it up for everyone. The other piece of legislation we're really focusing on is the workplace data. Currently, Missouri has no way of tracking workplace data. And when I say this, it is collected by a third party that is unbiased, and it specifically looks for healthcare shortages. So right now in the state of Missouri, we know where you live because your license is on your nursing license, and we know how many APRNs are here, but we do not know where you're working. So how many people live in Missouri and drive across that state line? How many people are unable to find a collaborator right where they live? We don't know those kinds of things. So it's very important to show with the regular nursing shortage as well as the nurse practitioner shortage to get this through. And then we're going to have some other coalitions bringing about some interesting legislation this year that's not real public just yet, but I can tell you there are multiple stakeholders that are very interested in decreasing the barriers for Missouri nurse practitioners. And that's everything from health insurances to nursing home associations, because again, when you look at health and health care, it affects a lot of people, and it affects a lot of different organizations and type of places.
How, kind of as an aside, how educated are the patients or just healthcare consumers in general in Missouri as far as what nurse practitioners can do for them?
I don't think as educated as they should be. And we are actually working on a project with Missouri State University to develop some videos that are going to be broadcast and put on YouTube that talks about nurse practitioners. A lot of patients do not understand the difference between a nurse practitioner, a PA, a physician. And so I also do some teaching, and that's why I always tell my patients, and I always tell my students to tell their patients, yes, I do have my doctorate. I'm Dr. Chapman, nurse practitioner, because I'm very proud of being a nurse practitioner, and my patients know what I can and can't do, and they are very, very supportive.
Mm-hmm. Yeah, I think almost anybody that I've talked with around the country, and certainly in my own practice in Washington, once a patient understands what a nurse practitioner can do, and once they connect with nurse practitioners, I mean, they're all in.
Yeah,
and that's
exactly
their preferred
right.
provider. Yeah.
And we're taught from the very first day we walk into that nursing class, we're taught holistic care. We're taught to listen. We're taught effective communication. And I think these skills really, that's why we portray so well. And that's why we have such good patient compliance.
Yeah, I agree. I agree with that. So let's talk more about the organization. You said that the papers were actually signed in July. So it's a brand new baby, if you will. And what is it that, how can nurse practitioners in the state support the organization?
Well, as always, there are two ways to support nurse practitioners or nursing organizations, and one is time and two is money. So it's kind of funny, we had our very first meet and greet yesterday in Branson, and I always tell everyone, if you can't give your time, give your money. And when I say money, I'm not talking $1,000. I'm talking just the dues, your yearly dues, just being a part of it. If you can't join, give your time, because ultimately our goal is to increase the outcomes for the state of Missouri. Our goal is we want our patients to get the health care that they need and deserve. And The only way, if you look at every single study across that board, if you look at even Duke, even the ION, they know the only way that we're ever going to do this is by reducing the barriers for APRNs and PAs across the board. So we have multiple committees. If someone is interested in joining committees, and in our committees, we have scholarship committees, we have conference planning committees, we have membership committees, we have advocacy committees that work on legislation, we have bylaws committees. And if a committee is not their cup of tea, then it's just being, you know, paying your dues, and that way you are supporting something. I think Missouri, that's the other negative thing about Missouri, is Missouri's so far behind on the ball because nurse practitioners and CNSs are, and certified nurse midwives, we're all so busy, work, that we forget to do the things that advocate for us. We are taught to advocate for that patient, and so we always kind of put ourselves on the back burner, such as when we were RNs working in the hospitals and you never went to the restroom or you never took your lunch break because you're work. It falls right on over into our practice as providers, and we need to learn how, if we don't advocate for ourselves in our practices, no one else is going to. So I really like the View this last 2 weeks ago, how they have really united nurses, and I really hope to see nurse practitioners do the same thing.
Boy, I really agree with you. I guess one of the ways that I actually explain it, when I used to explain it to my patients, if you are so busy taking care of everybody else, but you aren't taking care of yourself, then you're not going to be able to take care of everybody else. And I think that goes for mothers and for all of us as nurse practitioners. If we aren't paying attention to our practice as a whole in terms of our organizations and legislation and all of that, there may come a time when we won't have a practice.
You're exactly right. And we're tired of Missouri being so far down, and you know, we are not a backward state, so there is no reason for our state to have such poor health outcomes. And it's the time that we need to increase the access to patients and improve the patient outcomes.
Mm-hmm. So one of the things that I know that is going on right now, because I contributed to it, is there's the GoFundMe page.
Yes.
In order to hire a lobbyist. Is that correct?
That is one of the rationales. Our goal is, by the next legislative season, our goal is to have 1 full-time lobbyist and 2 to 3 part-time lobbyists. We feel like that's one of the reasons why APRNs haven't been as successful, is because we really need more support in the Capitol. And I've got some great national mentors that's kind of helped me through this process, and so we're looking at a multitude of different funding areas, from grants to donations to charitable giveaways and holding charity events. We're holding some CME classes that typically we would not charge people, but we're charging right now because we're using all of this money to fund our lobbyist effort.
So I just went ahead and put in to the chat box the link for the GoFundMe. So if anyone wants to take a look at that and go ahead and donate. Right now there's just a couple of people who have donated, but the more the merrier.
That's exactly right. And we haven't done this yet, but we have been, and this is public knowledge. We have a gentleman that is married to a certified nurse midwife that filed a petition with the State Board of Nursing last month that we got to go and be a part of. And the petition was, again, because looking at the statute is very broad, but when you look at the rules and regulations for APRNs across the board, that's where we get restricted down. And Mr. Williston really felt like that it is a restriction of trade. And in the past, Missouri's actually had 2 Federal Trade Commission letters about restriction of trade. And Mr. Williston asked the State Board of Nursing, because they did deny his petition during the hearing, and he does plan to further that. And the way to further that is judicially in a court system. So we do plan to try to help him in his effort to go that route as well. Because in the state of Missouri, you can change laws two ways: legislatively, which is up at the Capitol, or judicially, which is through the court system.
Okay, so those lobbyists are really important, and I think every state that has really been able to move practice forward has its own lobbyists.
That is
If
correct.
I'm not mistaken.
Yes.
Yeah.
And that's why we felt we wanted more than just one full-time one.
Mhm.
That's why we really felt that we wanted, that's our goal, one full-time one and 2 to 3 part-time ones. And the great thing is we've already been interviewing, and it seems like we've had a lot of interest, and a lot of interest from good folks that know what they're doing and have good relationships at the Capitol, which is important.
It really is. If the lobbyists certainly need to, just like we need to know what we're doing, they need to know what they're doing and how to best move things forward. Susie is asking a question: where can I see committees available to be part of?
Yes, they are on our web page, and we also have a Facebook page, but I don't believe the committees are on the Facebook page. However, there is a contact link on both the web page and the Facebook page, and that goes directly to both myself and Russ, who is the CEO of the business, and you send us whatever you are interested in, and we will definitely get you plugged in. We want to utilize anyone that wants to help or has thoughts that they would like to do something like that.
And I am sure, don't be shy in going forward and saying that you want to do something. So again, I want to invite everybody to go ahead and put in their questions. Be sure if you use the little Q&A at the bottom, that will help me see them easily enough rather than just being lost in the chat. And speaking of that, there is a question. Carla is asking, what is the Missouri Coalition of Nurses in Advanced Practice versus this group? And that's an excellent question, because that was one of the questions that I had as well.
That is a great question. The MOCAP, which is Missouri Council of Advanced Practice Nurses, is a subsidiary of MONA, which is the Missouri Nurses Association. And originally, MOCAP was made, and it was supposed to have a representative from each regional APRN group. For instance, APNO, RANAP, the Happenings from Southeast Missouri, 4th State and Joplin. They were supposed to send a representative and everyone kind of get together, and their big goal was to sit together, discuss practice problems, to discuss legislation issues. And I can remember back in 2010, 2011, 2012, we actually got to write some of the legislation. We got to write a Missouri white paper about Missouri APM practices. The problem is they recently went through a bylaws changes at MONA, and this group turned more into an advisory educational group, which is what the group's intent was to begin with. And MONA was able to form an advocacy committee then. And so the MOCAP group really now is more for education and networking, to discuss practice problems and things of that nature. But we no longer have that position that sits on the board, or we do not have that actual voice. We do get to advise what we think. So that was one of the other rationales for why we wanted to get a whole separate organization, because we wanted to make sure our voice was heard at the Capitol, and we wanted to make sure with the two groups working cohesively, there would be more support for both, for MONA's lobbyist, Kina, who is wonderful, and we're hoping that Kina will be able to support our lobbyists. And again, because the more coalitions we can build, the more support we have at the Capitol is always better. We are never going to be able to outmoney the physicians. For every $1,000 that we give at the Capitol, physicians give 70,000. So that's a lot of difference in money. However, when you stop and consider that there is over 100,000 nurses in the state of Missouri, that if nurses would just unite and support each other, we would be unstoppable.
Absolutely. I think we just saw that very clearly with what happened with The View, you know, and we actually had some sponsors, several sponsors pulled out of The View, including Johnson & Johnson. Let's see, I don't even know all of them. I'm familiar with Johnson & Johnson just because I do some work with Johnson & Johnson and Duke. But we are so powerful if we just come together. That
is exactly right.
And we're trusted. People trust nurses and nurse practitioners. And I think we just, you know, we need to take that momentum and move forward with it.
I agree with you.
Yeah, Quentin has a really good question here. He's asking, will having an organization in Missouri specialized in NP practice help more than Mona has in expanding NP practice in Missouri? And has this worked in other states?
That's a great question, Quentin. Actually, there is research. When the AANP group, American Association of Nurse Practitioners, originally started asking me to form this group, I was a little bit resistant for time purposes and because I have a very good relationship with Mona and I was concerned about that. Fortunately, they were able to prove and show me research from multiple other states that the way they were successful is by having a state organization dedicated to nurse practitioner practices. And when these two groups work together, the Nursing Association and the NP organizations, that they have so much more power and political pull that it is a lot different. Mona has done a great job. They advocate for nurses of all levels, whereas our organizations, don't get me wrong, because we will support Kina and Mona with their nursing issues on other levels, such as LPN and RN, but our primary focus is the APRN level.
Okay. And let me see here. I think it's Sharon has her hand up, and I am going to attempt to bring her in so that she can answer. I'm assuming, Sharon, that that's what you want. So you're going to get a screen, I believe, that is going to tell you to confirm that you want to come in. So you will be on camera, or at least on audio, as soon as you agree to that. So there we go. So for other questions, keep answering them, keep bringing them in. And for those of you that haven't seen it yet, I did post both the links for the GoFundMe page and also for the Association of Missouri Nurse Practitioners. And I've said before, this is a mouthful, the AMNP.
That is correct. We were trying to keep it where people wouldn't get it mixed up with other organizations. And when we originally incorporated it, we incorporated it for nurse practitioners only because I was taking mentorship from the AANP. However, then we came to realize that CNSs do not have their own organizations. And we came to realize that certified nurse midwives didn't have the support, you know, that they were also wanting support. CRNAs were wanting support. So then even though the name is AMNP, we do support and allow people to join from all the specialties.
Sandy is asking, which APRN organization are you affiliated? And I don't know if she means you specifically or the organization.
I think if we're talking about the organizations, we are a member of the AANP, the American Association of Nurse Practitioners. We get our continuing education through SLU. So the classes that we give out for fundraising in our conference will be accredited by SLU, St. Louis University. I'm sorry. Okay. I seen Barbara's face and I said St. Louis University.
I was going, Okay, so again, I want to invite people to go ahead and ask their questions. And Sharon, for some reason, I checked on you to invite you in, but apparently you're not coming in. So if you want to go ahead and just put your question in the chat box, then we can get to that. And Sandy did clarify that she was asking about the organization. So great. So Shanna, what are some of the other things that we as the folks out here, the nurse practitioners, what are some of the things that we should be aware of, or what should we be looking for to get involved with if there's specific things? I mean, you mentioned that some of them still weren't ready for prime time yet, but maybe there's some other things that we should be thinking about getting our caps on about.
I think the big thing is recognizing what good care that we give as APRNs. You know, every single study that has ever been done shows that we have the same as or better outcomes. There has never been a single study documented that says that we have less outcomes or decreased outcomes than physicians, either MDs or DOs. So I think it's a matter of recognizing of the quality of care that you give and start looking around for those barriers around you. How are those barriers influencing you? And I would love to hear from you all. We have a very open door and open email policy. Call us, email us. The numbers are on the webpage and on Facebook. Again, because one of our missions is we want to be that resource for you. And if you're impassioned to get involved, let us know, because we can definitely get you plugged in. We've got some very exciting things getting ready to come out in the next couple of months. And I'm hoping that they will be stellar and groundbreaking. So we'll definitely see about that. And once you join, you are on our emailing list. We try to get folks as involved as much or as less as they want to be. We are also in the process. We had our first meet and greet at Branson yesterday, which was wonderful. We are going throughout the state and holding meet and greets, and we're in the process. We've got Springfield set up. We've got Kansas City set up. We are still in the process of setting up Joplin's in St. Louis and Columbia. We are also, our goal is to hold quarterly meetings, and our quarterly meetings are going to rotate so that, for instance, it's not always in Jeff City, because I know in Jeff City, sometimes it's hard for the St. Louis folks to get there, or the Joplin folks to get there, or the Southeast Missouri folks to get there. And so if we rotate that around, then that way, hopefully everyone can come to some of the meetings some of the time.
Well, and on that note, I'd also like to know just how all of you are finding this kind of virtual meeting networking, if it's helpful or not. I know for me, you know, I'm here in Jeff City, but we also have some parents we're dealing with, and so it's not always possible to get out. So I tend to like this kind of stuff, but I'd love to know what the rest of you feel about this as well, because this is something that we've talked about that maybe we can do more of in the future. Anise is asking, what is the status of current or future/current legislation in Missouri for APRN full practice authority?
There is quite a bit, actually. One of the things I want to point out is the State Board of Nursing has been absolutely wonderful. In fact, the National Council of State Boards of Nursing has put out an APRN compact licensure, like the RN compact licensure, and the State Board of Nursing is very supportive of it. However, again, that has to either go through legislation or it has to go through judicial, through the court system. The State Board of Nursing is planning on submitting that. The APRN compact licensure is full practice authority without any barriers. The other thing we've got going on is we've got several coalitions that have made a lot of connections with some of the big insurance companies, the different associations, and we hope to see more about that in our immediate future, because again, the more people you can pull in, we don't want this to be just about nursing, because it's not. Yes, it's terrible that we have bad practices, but it is hurting our patients. And that is what we have to be so concerned about. I mean, we are 42nd worst in the nation for premature deaths, 49th worst in the nation for immunizations. You know, so again, if we get the access to care by decreasing our barriers, we improve that. And so I really do think we're going to see some great things on our horizon. It's not something that's going to happen overnight. Mona has worked on this for 20 years and has done a great job, but it's time that we give Mona the support. We're all working together. We get these coalitions involved. We get these insurance companies, these different associations involved, and that is going to make a huge impact.
You know, I think it's you know, for a lot of companies, for a lot of organizations, for stakeholders, there's a lot of money involved. And I would assume, and in fact, I'll bet my bottom dollar on this, that insurance companies are getting more concerned in getting nurse practitioners to be able to do the work that they do, because it's costing them so much money. And that really is a big way that people will finally start making changes, is when it starts costing a lot more money.
And that is exactly what we are seeing. The diabetic patient, had they had access to care, wouldn't have ended up in diabetic ketoacidosis in the ER. The congestive heart failure patient, if they would have had the preventative care and had the proper access, most likely would not have ended up in the ER. And not only the ER, then you've got hospital bills for this. And they found out that our Medicare patients are going from about a sixth down to up to a fourth of Missourians will be covered by Medicare. And there's 6.5 million people in the state of Missouri. 37% of those are rural. So we really have access to care issues in the state of Missouri.
Yes, yes. And actually, even before I moved here, I saw a big article in NPR about that, where all these counties where there is absolutely, there's no physician and nurse practitioners can't function out there. Oh, here's a question about the VA system. What is the status of independent practice for APRNs in the VA system?
Sandy, I'm very passionate about that because I was part of that big movement when I worked at the VA. It was about 2010, I believe, when the VA decided they needed to have an actual policy in place. And the policy got all the way through the channels until it hit the union. And once it hit the union, it kind of got backslashed. And then once it got backslashed from the union, the AMA found out about it and started fighting it. And so then it had to go through legislation. And so it's became this big volcano when it was this little bitty molehill to begin with, which is kind of ironic. I really do think that's going to pass this next year. That is not on a Missouri basis. Of course, that is on a national basis. The last couple of people I've talked to on the national level suspect that it will pass this year. That is also going to look very good for Missouri APRNs. And I've testified to that several times in the past, because if you can practice independently in the VA system and you walk out that door and all of a sudden you have to have a collaborator, does that mean you got dumb the minute you walked out the door?
Well, that's the same thing I've always wondered, that if you could practice relatively independently in a rural area, then why can't you practice in an urban or suburban area independently?
Right.
You know, are your patients just not, you know, your patients in the city are, they just need more care, or they need, you know, quote unquote, better care than the folks in the rural area?
Well, you can't practice independently in the rural area. You still have to be within 50 miles of your collaborator.
Yeah, yeah. And well, in some states there is a little bit more wiggle room there for that, but it's the same issue.
Right.
You know,
We had a lady that moved 52.5 miles. So she was 2.5 miles outside of the range and actually went and tried to get that exempted, and they wouldn't take it. So it's kind of crazy.
It really is crazy, and some of these restrictions are just downright dangerous to our patients and our practices. I was going to say that one of the things that is, and I don't know whether I'm glad or not, but in California, the Practice Act in California there's not even any state practice act. It is all based on individual organizations. So if you were working, for instance, say through the Kaiser system, which is a big hospital system in California, and they say that you can do all of these huge things, then that's fine. But if you go to work for Dr. Smith down the road, Dr. Smith may say, no, you can't do any of those things. You can only do these certain things here. And so there's just no rhyme or reason between practice acts in the state of California. So.
Well, and that's why the National State Boards of Nursing Council came up with the compact licensure, because we all take the national licensure exam. All of our schools are nationally accredited to be able to do that. So it only makes sense for us to be all across the nation to be able to do the same exact thing.
Right, exactly. So I had earlier asked Shanna what people thought about doing the virtual thing, and we got a lot of yeses on that.
Yay, that is wonderful.
So that's great. That's great. So we're closing in on our hour. We've got another 10 minutes. So if there's more questions, go ahead and bring them in before we just go ahead and call it an evening. And I'll go out and see if we can see this wonderful eclipse that's about to happen. So, Shanna, what else should folks know about getting involved, or just some things that are coming up?
Like I said, we have the meet and greets coming up. We have the different fundraisers. If you want to be involved with any of that, let us know. You can call or email us at any time. We've got some great big stuff coming up that in the next few months that's going to be a little bit exciting that I can't just reveal quite yet. We've got lots of things on our horizon. The big thing right now we have to do is work on getting the word out about this organization, and we have to get nurse practitioners, CNSs, CRNAs, nurse midwives. We all have to get everybody united behind the same cause, because it does affect every single one of our practices. When you get over 8,000 of us together, that's over 8,000 votes. And you can bet there would be some changes.
Yeah. So Carla's asking about dues.
Our dues are set at $80 for a full membership, which means if you want to, you can be as involved as little or as less as you want to be. And then we also have student or retired dues, and those are $40 a year. We do let retired members and students sit on some of the committees as well.
Are you, Susie's asking, are you available to answer questions about what we can or cannot do?
Sure. And Susie, if I don't get to your question during this, don't ever hesitate to email or call me. As you know, in a rural area, we are limited to being 50 miles from our collaborator. In an urban area, we are limited to being within 30 miles of the collaborator. The collaborator is required to come on site every 2 weeks. We are, for a new diagnosis, we are required to have our patients follow up with our collaborator. We are required to work side by side with that collaborator for 1 month. So if you're in a rural clinic and your collaborator retires and you get a new collaborator, you still have to work side by side with that physician for a month before you can be allowed to work within the 50 miles.
Well, some of that's news to me.
Yes, it's crazy. But like I said, you know, the hydrocodone got fixed this last season. The death certificates got fixed. So I am very, very hopeful. And in fact, we have got a gentleman that approached us to work on contract with us just to build those coalitions at the Capitol, which I think is very exciting. So again, the more of us that are on the same page and are supporting each other, the better off it is.
Sandy is asking or stating, I have a meeting for the St. Louis PNP, I think is what it is, group on Thursday. Do you have flyers I can hand out?
I definitely can. I can actually email those to you, Sandy. Now go ahead, sorry.
No, I was saying good. Go ahead.
I have those that I can email out to you, everything about the organization. We are in the process of setting up a meet and greet in St. Louis. I do not have a specific time yet. My husband just found the drug rep to put that on this past Friday.
Susie is saying she works in a hospital organization. What invasive procedures can she do? Central line placement, art line placement?
Now that's a tricky question because that's not delegated in the state statutes and that's not delegated in the rules and regulations. It is what your collaborating practice agreement delegates to you from the physician. So most institutions, you have to do so many successful ones, but again, you have to make sure it's in your collaborative practice agreement. The physician has to sign off and they have to see you usually do, most places are 10, some places are 25, and then you're able to do those, you know, independently.
Okay. All right. Looks like we're about out of questions. Unless anything comes in the next few seconds here. So why don't we, so your next meet and greet is where?
Our next meet and greet is actually in Springfield on November the 5th at Metropolitan Grill. We've got some suturing classes. We're going to be in Kansas City this coming Friday. We've got some Kansas City meet and greet is November the 12th. We've got an EKG class November the 18th. So we have lots and lots of things, lots and lots of things to do that.
All right. Okay. And Keith is also stating that the Board of Nursing said that if it isn't a prescription, then you have authority without a CPA, I'm assuming collaborative practice agreement.
I bet this is Keith Williston that filed the petition, and Keith is a very, very smart individual that knows the rules. However, I would caution that it depends on how they interpret that. And I would be more than happy, Susie, if you want me to, I can talk to Deb Funk, who is the practice coordinator or the practice director, and I can get it in writing for you because I don't want anybody to ever do something that could possibly get them in trouble. I've always been told that the collaborative practice agreement has to delegate what you can and can't do.
You know, and that's actually the way that I understand it in talking like with Carolyn Buppert and some other folks in various different states, because I have a lot of nurse practitioners that say, well, if I'm not prescribing medications, do I need to have a collaborative practice? But if you look at many of the laws, and I don't know the laws that well here for Missouri yet, but a lot of them will say that if you are functioning in the role of a nurse practitioner, that you do have to have a collaborative practice agreement, and that includes the assessment, diagnosis, and treatment, even if it isn't a prescription medication.
And the only caveat with that is, and this is why I would want to check for Susie and get it in writing, is because I know for assessing, if you have a patient that comes in and gets a new diagnosis of hypertension, even if they're not unstable and you do not prescribe medicine, but you're doing a low salt diet, you're doing exercise, you're doing all these other things, by law, you're still supposed to have that patient follow up with a collaborating physician within 2 weeks. And so that's why I'm a little bit hesitant. I just don't want to give out any bad information. I know without a shadow of a doubt, Keith is smarter than a whip. He is great. And I trust everything he says. But unfortunately, in the state of Missouri, sometimes it comes out to who interpretates what.
Right.
And I just want to be safe. But Susie, if you will email me or call me with your email address, I will keep your name out of it. And we'll talk to Deb Funk, who is absolutely great. And I will get something in writing for you.
All right, excellent. So I am so glad to meet all of you this evening, and Shanna, I'm so glad that we were able to use this technology to bring everybody together. Again, I have put in the links for the GoFundMe as well as for the Association of Missouri Nurse Practitioners, the website where you can go ahead and join. And again, the GoFundMe page, if you want to consider donating some funds so that it can go forward to help us all. So any last words here before we say goodnight?
I just want to tell everyone, thank you for coming. We just need to get this word out and get people involved, whether it's with time or dues. Either one works, but we've got to get everyone united and on the same page.
All right. And since there's so many people that seem to enjoy this format, we'll have to talk about doing it again.
That sounds wonderful.
All right. So everyone, thank you. And Shannon, will the replay of this, for those that didn't make it, be on your website then?
Yes,
on the association
definitely.
website? Okay. Excellent. All right. So I will say goodnight to everybody then.
All right. Good night. Thank you.
Bye-bye now.